Hey everybody, Dr. Brianne Callanan here, naturopathic and functional medicine doctor. And in this video, we are going to talk about the particular bacteria that I'm seeing more infections of in my practice currently, called H. pylori. H. pylori is a bacteria that can be present in up to 50% of the population. It is a bacteria that lives in the stomach. And when we see heightened levels of this bacteria, we can see a variety of symptoms, everything from symptoms that impact the digestive system specifically, like gas, bloating, heartburn, but this can also extend to chronic symptoms such as issues with nausea, feeling full after eating, nutrient deficiencies, stomach pain, feeling heartburn or tickling in your throat, or chronic cough or chronic throat clearing. We can see, of course, burping and fullness after eating. This particular type of bacteria, interestingly enough, has been associated with autoimmune conditions such as irritable bowel disease, autoimmune thyroiditis or Hashimoto's, type 1 diabetes, rheumatoid arthritis, Sjogren's. It can cause chronic urticaria or unexplained hives out of nowhere, psoriasis. We have seen this associated with a heightened level of anxiety and depression, as well as in unexplained fertility cases. So we're going to go through today what the symptoms are, how you can get proper testing, and what are some of the treatment options that I utilize in my practice. This video is for educational purposes only. It should be not taken as medical advice, and always speak to your healthcare provider before starting any changes to diet, lifestyle, supplementation, or medication. So H. pylori, like I said, is a bacteria that's commonly seen in individuals, and it can live in the stomach. Now, how do you get testing? There is a blood test available, but the blood testing, the problem with it is it's only accurate for acute infections. So typically we only see the blood test come back positive within 1 to 2 weeks of an acute infection. This can be missed in chronic cases. In my practice, I most commonly utilize a DNA-based stool test called the GI map test. This is a test that you can easily do at home. You provide the stool sample and ship it back to the lab. If you are in Canada, you can contact my patient care coordinator to get a kit shipped out to you. If you are in the US, you can order direct through a wholesale lab company that I've partnered with called Rupa Health. Their pricing is fantastic and it's very convenient to use. Now, when we're looking at the stool culture, one of the things that I really appreciate about the GI map is it not only looks at whether or not H. pylori is present, but it also tells us information about the particular strain of H. pylori that a patient might have. So as you can see here, the GI map reports on the quantitative level or the amount of H. pylori that is present, as well as the virulence factors. Virulence factors tell us how likely is the particular strain that you have to create issues, such as issues with chronic infections, issues with ulcers, issues with duodenal and stomach cancers. This could coordinate our treatment plan and how aggressive or how long we have to do the treatment plan. The GI map is very comprehensive. It not only looks at the presence of H. pylori, but it also looks at the presence of your normal bacteria, or what particular type of probiotic you may or may not benefit from. It looks at bacterial overgrowth, viruses, parasites, worms, intestinal health markers such as calprotectin. Is this a IBS case or an IBD case such as Crohn's or colitis? It looks at microscopic blood levels in the stool, which would be a concerning factor for colon cancer. It looks at non-celiac gluten sensitivity, your immune system, how you're digesting your foods, and whether or not you have leaky gut. So it is a very comprehensive test that I personally run on myself each and every year. Now, in terms of autoimmune conditions such as hypothyroidism or Hashimoto's, Hashimoto's says that the immune system is attacking the thyroid gland and making it less productive. So in patients with H. pylori infection, we do see that this is an association, meaning that it could be a risk factor for turning on the autoimmune process. So if you have a strong family history of autoimmune conditions, or perhaps you have an autoimmune condition, specifically looking at gut pathogens could be quite beneficial. We also see that H. pylori is associated with chronic urticaria or chronic hives. 36% of patients with chronic idiopathic urticaria, meaning you have hives and we can't figure out why. Those patients were more likely to be infected with H. pylori compared to the controls. Even better, we do see positive response in terms of treating H. pylori. The hives go away in a significant number of individuals compared to the controls who were not treated. So this is particularly interesting how we're seeing a gut-skin connection. So if you have chronic urticaria, it may be worthwhile to have a look at H. pylori and considering whether or not eradication of this bacteria could be helpful for you. Infertility is an interesting one. There are studies that show that H. pylori infections are significantly higher in patients with unexplained infertilities in compared to the control group. We know that infections with H. pylori that carry the virulence factor Sig-A showed in women an increased likelihood of premature miscarriage. We also know that males who have unexplained infertility, who have H. pylori, show a lower amount of sperm count compared to uninfected males. So perhaps eradication of the H. pylori in males with unexplained fertility could be helpful. In addition, some patients who have autoimmune antibodies towards sperm can be infected with H. pylori as well. So if you have the presence as a female of autosperm antibodies, having a look at whether or not H. pylori is present and treating may be an effective strategy to utilize or consider. H. pylori and anxiety. It is quite interesting the impacts and the connection between the gut and the brain. We know that the wrong types of gut bacteria can increase cravings or food cravings, leading to resistant weight loss. And we also know the wrong types of bacteria can predispose an individual to anxiety or depression. This was a small study, but it was showing that H. pylori is strongly related to depression in that when we treat the H. pylori, the depression and anxiety does also appear to resolve. Now, this is not going to be for everybody. This is not to say H. pylori causes anxiety or H. pylori is the sole contributing risk factor for depression. But when we're looking at holistic health and naturopathic and functional medicine, treating the body as a whole and investigating gut health when we're considering patients who are struggling with their mental health is quite important. Now, what do you do in terms of the H. pylori treatment? So the best case scenario is we have a look at your symptoms. We run the stool test to see if H. pylori is present. There are some individuals where the symptoms are so concrete and point so towards H. pylori that we do an empirical treatment. So we do treat without the stool testing. Now, best case scenario, you run the stool test, but I recognize this is a cost and a financial investment for a lot of individuals. So if you are unable to run the stool testing and we are really thinking that H. pylori is the underlying factor, we can treat empirically with the natural treatment option because the adverse events that were reported in the study were 0. The treatment option for H. pylori conventionally in our medical model is 4 different types of antibiotics, which can carry some risks and can be detrimental to the normal bacteria flora. H. pylori requires 4 different antibiotics because there is strong resistance. The nice part about the GI map test is they'll actually expose the H. pylori that you specifically have to the antibiotics to tell us whether or not it would be an effective treatment. Now, for the vast majority of my patients, we try not to overuse antibiotics if they are not needed. There is a small study that was conducted that showed that there was success in utilizing natural ingredients for the eradication of H. pylori in just a 2-week time period. So that's what I'm going to share here. In this particular study, which I will link at the bottom of the video, the researchers utilized mastigum, oil of oregano, Pepto-Bismol chewables. Pepto-Bismol does have an active ingredient, bismuth salicylate, which has been shown to be effective at H. pylori. They also used a probiotic and a blend of soluble and insoluble fiber. I have repeated this exact treatment plan for a number upon number of individuals in my practice, and we've seen eradication and successful symptom improvement. Now, in my practice personally, I utilize the mastigum, the oil of oregano, and the Pepto-Bismol chewables. For some patients, we utilize the fiber and the probiotic. It all depends on what the GI map says. So the GI map stool test can really tell us whether or not you need additional fibers or if you need a particular bacteria or a probiotic, and what particular probiotic would be the best for you. At a baseline, utilizing the first 3 ingredients could be a good start for you. Now, what do the products actually look like? So GastroMend by Designs for Health does contain the mastigum. It also has other healing ingredients which really support soothing the lining of the stomach and the small intestine. I utilize 2 caps 3 times a day of the GastroMend, 30 minutes before meals or on an empty stomach. The GastroMend does contain the 500 milligrams of the mastigum when utilized at those dosaging. Again, don't start anything without your doctor's permission. For the GastroMend, you will need 2 bottles in order to complete the 2-week treatment study. In order to complete the 2-week treatment that was shown to be effective in the study. The GastroMend bottle will actually last 20 days at this dose. So the vast majority of my patients are on this for 20 days because there's no point in leaving behind extra supplements. The oil of oregano, 1 bottle 3 times a day with the GastroMend is the equivalent dose that was utilized in these studies. Pepto-Bismol chewables, again, the bismuth salicylate is a treatment option. It's not just for the symptom management. So 4 to 6 chewables a day of the Pepto-Bismol. Now, keep in mind, you could have an allergy to NSAIDs. If you have an allergy to NSAIDs, the Pepto-Bismol is not going to be a viable option for you. Pepto-Bismol may also cause darkening of the stool and darkening of the tongue. So it's important to recognize those symptoms as a potential. They will go away when you discontinue the treatment. But again, always talk to your doctor, naturopathic doctor, functional medicine doctor before implementing a new treatment. So I hope that was helpful for you. I wanted to share rather quickly about H. pylori, what are the symptoms, how to get proper testing, and what treatment plans I'm finding to be effective in my practice, because this is something that I'm seeing more and more of. If you have any additional questions, please reach out to my office. We are accepting new patients. My patient care coordinator, Allison, is fantastic, and she can help you set up a one-on-one if you'd like to go ahead and order the testing and review it with me in a one-on-one visit. Hope that helps. We'll talk soon.